So today in this class we are going to discuss about the therapeutic communication. Therapeutic communication is very essential to maintain a good nurse and client relationship. So in order to provide a good care to a patient, the client should first trust us. So the trust it is going to be established based on this therapeutic communication. So, as a therapeutic nurse, what we have to do and what we should not do. What is a therapeutic response and what is non-therapeutic response? That is, we're going to see in this class. So, first in therapeutic in therapeutic communication, first the quality. These are the qualities, okay, which a therapeutic communication and how a nurse should react in therapeutic communication and how we should not react. How we should not react, it means it's a non-therapeutic communication. First, we will see therapeutic communication, then we will see non therapeutic communication. So, first, therapeutic accepting initial action or response. So, whatever the client is, if the client is ready to say something, no, our initial action should be the response. We should accept. Okay? Then the second one is broad open. So, tell me more about it. If the client is telling you something, okay, the client is saying that I'm having this pain, we should ask him, okay, tell me more where it is, when it is occurring, how it is coming, along with the other signs and symptoms. Do you have any nausea or vomiting? That kind of like we should explore the client feelings. We should ask him to tell about that pain or tell about the feeling more. So broad opening. And the third point is encourage expression. That's what, as I said, we should explore his feelings. We should not ask him to stop, or we should not stop or suppress his feelings. We should not say, "Oh, okay, you have pain. It's a common symptom of your condition." That reaction or that response. It's not a therapeutic communication. So we should be encourage him for expression and offer self. So offer self is nothing but we should be available. Okay, we should give time to the client. So make yourself available for the client. So whenever client is telling something, we should not say, "No, I'm little busy. I'll communicate with you later, or I'll listen to you later." That kind of response that is not appropriate. In order to maintain the trust, we should provide ourselves. We should offer ourselves. That is how the client will develop the trust, and he can explore more about his feelings. Restating. So same paraphrasing. What the client is saying, we should restate. Okay, like if for example client is saying, I'm having this pain. Oh, fine. You are having pain in the leg, right lower leg. Could you please explain it further? Or could you tell me along like what is happening? We should say that same paraphrasing. We should not say we should not say to patient oh, it's okay, that will be fine. Oh, it's okay, it will be soon after taking the medicine. So we should restate presenting the reality. So for example, if the client is having the hallucinations, so first response okay, I understand you're hearing the voices, but this is the truth, like I'm not hearing the same. So we should present the reality. We should not give the false hope or false promises. The client is in end stage of any disease, we should not tell the client like it's gonna be fine or you're gonna be all right. That kind of statements or that kind of statements will give the hope to a client. So in a therapeutic communication, we should present the reality. Silence. Silence is nothing but whenever we having silence, we are having more patience, right? We will be listening more to the client, making observations. So we should observe. You look like this. You seem to be more anxious. You seem to be more nervous. Would you like to explain something? Would you like to talk about your anxiety? Like that, we should make first observations. Then we should discuss with the client on the same thing. Active listening. We should pay more close attention to what client is saying. We should not listen if we are doing some other work and client is saying something to us. If we are not paying the attention, the person who's communicating it, whether it is a client or whether it is another member, they lose the interest. They will not be having that interest to communicate with us, right? So we should pay close attention. Clarification. clear any doubts. So whenever the client is having any questions regarding the medication, disease, or what is this medication purpose, or what is the purpose of doing this lab test or something, we should clear client doubts very clearly. Refocusing, picking up the central topics. For example, if the client is saying many things like I'm having this condition, that condition, and I'm going through this, going through that. So we should like in all these, he's saying something about the suicidal attempt. In that scenario, we have to focus, we have to concentrate more which point we don't know that gonna help us to prioritize his treatment or to concentrate more on the client. Now clients with the mental health disorders, they will be talking with the loose connections, they like flight of ideas, everything will be present at that time. We should pick up the central topics, focusing, explore a specific topic. So if the client is saying something, he's disturbed because of his father, mother, or someone else like friend or his job or his personal relationship, whatever. If he's saying he's suffering because of that, we should try to explore his feelings on the particular topic. First, we should listen, we should observe, then we should ask, and we should express more feelings of the client on that topic. So these are the points where a therapeutic nurse should follow in order to maintain a proper therapeutic communication and establish a client nurse and client relationship. So in the next class, I'll be discussing on the non-therapeutic communication points. Thank you. Thanks for watching. Please do subscribe the video.